look, I'll try and cover in 10 minutes or less 5 questions around international cooperation, looking at dynamics and patterns rather than specific details. So I'll start by just a couple of words on why I think we see less international cooperation than we'd expect in such a crisis and pandemic. I'll touch a little bit on where it has occurred and what we're seeing. And then I'll reinforce some of the points that the other speakers have made of where it's essential moving forward. And I'll finish by talking a little bit about how the pandemic could change the dynamics of international cooperation and what we can actually do about that. So starting with why it's been far less intense and evident than one would expect. A few points here. I think it's pretty clear if you've been following state relations over the last let's say around 5 years, that neither the spirit of the times nor the state of international engagement mechanisms are supporting a deepening of cooperation and coordination across national borders. 2 things have happened that's made that the case. One is that international cooperation has been politicized and made to seem risky. The days are well and truly over when it was routine for the UK to cooperate deeply with the EU, unfortunately, or for the US to cooperate with almost anyone on first instance. And that has had an effect in that many countries, the administrative state, in terms of those interconnections of cooperation, have been really hollowed out. Cross-border cooperation is not about grand statements and political commitments. It's about practical actions where someone who trusts someone else in another part of the world can pick up a phone or send an email or wire a transfer or create incentives that then drive action. And unfortunately, we've seen an undermining of global institutions that support that cooperation, but the individuals within governments that have traditionally played those rules have really disappeared in many parts of the world. And I guess I'm talking particularly here about those that are typically expected to lead in these areas. So US in particular, and to a certain extent the UK, those aspects have been lost or degraded. I also think that the dynamics of a pandemic are very different to most other types of crises, and there are barriers to cooperation that are created by the nature of the pandemic itself. One that I think Gilles mentioned is that a knee-jerk response to the spectre of transmissibility is to break interconnections and break interconnections where you have power to break them. The first set of powers that a national or federal government is to break border connections because it's within their authority to do so. So you get these interconnections breaking that actually then reduce the ability for states and for communities to cooperate after the fact. You also get transmissibility promoting finger pointing and blame. It incentivizes politicians and pundits to blame other countries or communities or groups as sources. And anticipated and global shortages. So when people can already anticipate that a pandemic of this nature will overwhelm systems, it will incentivize people to shut down connections, such as put export bans around hydroxychloroquine, as we saw, medical supplies, and in some cases, seeking to get material from other territories at almost any cost, including deception, which increases distrust and reduces cooperation. That's before we get to the fact that the extent of the pandemic has reduced all of our capacity for cooperation. And I guess I'd finally also add that the data are still not clear. There are incentives to lie, unfortunately, in a crisis of this nature, to minimize panic, to look like you're doing a better job, or to avoid blame. So that's one of some of these elements that are contributing to why we're not seeing this cooperation. Now, where we have seen cooperation, international organizations are really out at the front. My view is the WHO has done a great job under very difficult conditions in public communication and leadership. Of course, sensitivities and issues around things such as the status of Taiwan. And groups like IOM and OCHA are also doing great work, but their funds and resources are way too small. We've seen bilateral relationships, so not regional cooperation, but bilateral relationships around repatriation and some agreements over treatment and exchange of material, but again, not systematic. We've seen far less from regional blocs than I certainly would have expected. Vague statements from the G20, some interesting discussions between ASEAN and China, and really, as David and others put forward, and Victoria just then, a really kind of a lackluster response from the European Union. So where is it absolutely essential that international cooperation takes place to move forward through the crisis and into recovery? Well, I think first and foremost, economic and healthcare assistance to vulnerable countries and vulnerable populations is a matter of international concern and international cooperation. Immediate support is going to be needed in particularly least developed countries. The age profile of most LDCs and developing economies makes them actually more resilient to the health effects of the coronavirus compared to others. So in India, the median age is 27 compared to Italy's 45, which means that cohorts that will be more affected by the crisis are smaller, relative speaking. But the health system shortages in those countries more than offset these age-related advantages. And there's a huge systemic economic impact, both on those countries, but also on vulnerable populations, even in countries like the United States. And I expect that today the US will announce that another 5 million US citizens filed for unemployment in the last week, which adds to the 3 million announced last week. The St. Louis Fed is predicting 32% unemployment, or positing that that's possible in the United States. That's one of the world's most competitive economies. So international cooperation around economic and assistance of those types is absolutely critical. And I think Victoria's points and insights around the heterogeneity of those approaches is really important for us to understand and track moving forward. I also think that the reopening of the international movement of people is a critical aspect for international cooperation, particularly for recovery. Air travel alone contributes about $3 trillion US dollars to the global economy. And migrants more than double their economic contribution. So stopping migration and incentivizing people to move home is a massive cost to the global economy. It's around, migrants contribute around $7 trillion to the global economy. So more than double what they would contribute in their home countries, according to IOM and others. And finally, for vaccine development, pricing and distribution, it's essential that making sure that any vaccine is effective across diverse populations, so relevant globally, and scaled and allocated and distributed well is going to be pretty clear. So with a couple of minutes left, what could we see as a result of the pandemic here? Well, in the short term, I think we do need to learn the lessons from history that the virus itself may well hamper international cooperation in very direct ways. Woodrow Wilson was affected by the Spanish flu when he attended the Paris Peace Conference at the beginning of 1919. And the assessment is that him being ill seriously affected his ability to negotiate on behalf of the United States during the Paris Peace Conference, which influenced the fact that he was unable to convince the US Senate to join the League of Nations. That's a pretty long bow to draw, but I will say, if we see world leaders being affected by the virus, which we already have started to see, that will impact international cooperation. We could also, as Kamal Dervis and Sebastian Strauss have argued, see a crisis of global governance, a major extension of isolation, and a rise in fear and bias among national populations as a result of this. One of my friends was recently assaulted in LA for being an Asian American. We are seeing the response to the virus invoking tribalism that is not in favor of cooperation. We will undoubtedly see that the pandemic leads to new configurations and limits in terms of movements of people and relationships. And I really expect to see an explosion in bilateral corridors of trade and movement of people, not to mention the fact that international movement will feel very different after the crisis than it did before, much like a 9/11 type event, but with a healthcare impact. And we could see the emergence of private systems of movement, which will further entrench inequality in terms of international movement. Jean-Marc, you mentioned at the beginning that the pandemic is also likely to shift the role of the state. So more authoritarian governments could be more likely, which will impact state relations. But you also could see effects like huge investments in digital public goods that will equally change those relationships. So to finish, what can we do? Let me throw out four ideas here. I think, first of all, we really need to be politically engaged as well as economically and socially engaged. But I would urge that political engagement is constructive policies, not divisive politics. Politicizing the crisis is very tempting, but I think not helpful, particularly in the middle of this. We also personally need to behave in ways that reduce the impact of the hold on a second, I'm just getting some sounds here. We need to personally behave in ways that reduce infection rates for ourselves and others, and support the solidarity that Gilles mentioned in his discussion earlier. Third, I think we should be creating narratives that support collective resilience rather than isolationism. As David mentioned, global risks more often than not, cluster. We need better healthcare cooperation, but we also need more and better strategic foresight. And the fact that, as Jean-Marc mentioned, so many leaders completely overlooked the warnings and assessments of the threat of a pandemic, despite the work that had been done, is really a lesson to take for the future. And finally, and I think this is Victoria's key point, which is spot on, we need to invest in people. The physical equipment that you would expect to be degraded during, say, a wartime footing or other natural disasters, that's likely to be kept largely intact during the course of this crisis. But people's skills will degrade, people's mental health will degrade, and they will be more fragile and risk averse. So investing in skill development and social benefits will be absolutely critical for those countries who feel ready and able to really take those animal spirits and create a steep recovery rather than a long depression coming out of this pandemic.